Hello, Dr. Ammar here again, and in this video lesson we will talk about the skeletal framework of the back, and at the end we will have 45 review questions to test your knowledge. If you have any question, you can email me here at ammar@goodrational.com or comment your question down below. Objectives: what we want to get out of this lesson: first, description of vertebrae and its embryological origin. Then we'll talk about the cervical, typical cervical, atlas and axis, thoracic, lumbar, sacrum, coccygeal. Then we'll talk about the intervertebral foramina and describe them. Then the posterior spaces between vertebral arches. First, vertebrae. We have already mentioned that the skeletal component of the back consists mainly of the 33 vertebrae here, but the skull, scapulae, ribs, and pelvic bones also contribute to the bony framework of the back and provide sides for muscle attachments. Now, these are the 33 vertebrae. They are subdivided into 5 groups depending on the shape or the morphology of the vertebrae, and also on the location to which body region do these vertebrae relate. For example, we have 7 cervical vertebrae that are associated with the neck, 12 thoracic that are associated with the chest, lumbar 5, they are associated with the abdomen, sacral, and coccygeal associated with the pelvis. The 7 cervical vertebrae, which connect the head with the thorax, are characterized mainly by their small size. Not only by their small size, but also by their foramina transversarium, or the foramen of the transverse processes. The 12 thoracic vertebrae, which connects the cervical vertebrae to the lumbar vertebrae, are characterized by their articulated ribs. Now, although all vertebrae have rib elements, but in regions other than the chest, the vertebrae have rib elements that are small and are incorporated into the transverse processes. But in the thorax, the rib elements are large, and ribs articulate with vertebral bodies through synovial joints and also with the transverse processes. Inferior to the thoracic vertebrae are the 5 lumbar vertebrae. They are characterized by their large size. Why their size is large? Because as we move downwards from C1 to the lumbar 5, the vertebral body increases because the amount of weight supported by these vertebral bodies increases. Not only this, but also lumbar vertebrae constitute the skeletal support of the posterior abdominal wall, so they support the weight of the body as well as the abdomen. Much of weight, much of size. Next, we have the 5 sacral, which are fused together as a single bone called the sacrum. The sacrum articulates on each side with the pelvic bones, and its component with the coccyx of the posterior pelvic wall. Now, inferior to the sacrum is the coccyx, which is 3 to 4 coccygeal vertebrae fused together as a single bone. It is a rudimentary structure, and it is triangular in shape. Now, let's talk about the origins of vertebrae, the embryological origins of vertebrae. Let's see. In the embryo, the vertebrae are formed intersegmentally, as we can see in this picture. Each vertebra is derived from cells called sclerotomes. Now, the sclerotomes is the inner medial layer of somites. Each somite has inner medial layer called the sclerotome, and outer lateral layer called the dermomyotome. Now, vertebrae originates from the sclerotomes, or the inner medial layers. Let's take a look at this middle vertebra, for example. This vertebra is divided into upper half and lower half. Of each vertebra is derived from the inferior or the caudal part of the somites above from each side, and the inferior half or the caudal part of the vertebra is derived from the cranial parts of the somites below. So each vertebra is composed of upper half and lower half. The upper half is derived from the inferior or caudal parts of the somites above, and the inferior part or the inferior half is derived from the cranial part or superior part of the somites below. And the spinal nerves develop also segmentally, and they pass between the forming vertebrae in here, between the forming vertebrae. Now let's talk about the typical vertebrae. First, let's have a little bit of description about the components of each vertebrae. Let's talk about it in this way. First, let's talk about the vertebral body. Next, let's talk about the vertebral arch, and then we shall discuss the projections coming out of the vertebral arch. First, the typical vertebra. Each typical vertebra consists of an anterior vertebral body and a posterior vertebral arch. And vertebral bodies are linked to adjacent vertebral bodies through the intervertebral discs. Vertebral body is the major weight-bearing part of the vertebra. It is also linked to adjacent vertebrae not only by the intervertebral disc but also with ligaments. Now, as we said, the size of vertebral bodies increase as we descend downwards from cervical 1 to the lumbar 5. Now, let's talk about the vertebral arch. The vertebral arch forms lateral and posterior parts of the vertebral foramen. Here is the vertebral foramen. It is small, however, when all vertebral foraminae comes close together, they form the vertebral canal, which contains and protects the spinal cord, and the vertebral canal is continuous upwards with the cranial vault or the cranial cavity through the foramen magnum. Now, each vertebral arch consists of two lateral pedicles, which forms the lateral pillars of vertebral arch, and two laminae. These laminae are flat sheets of bones. Take a look, it's a flat sheet of bone. They extend from each pedicle to meet at the midline, where they give rise to the spinous process. The spinous process. Now let's talk about the projections that come from the vertebral arch, including the transverse processes, the articular processes, and the spinous process. Starting with the spinous process. The spinous process projects posteriorly and inferiorly, which means backwards and downwards, as you can see in this picture, backwards and downwards, from where the meeting of the two laminae in the midline. And the spinous process is a site for muscle and ligament attachment. Now the transverse processes. The transverse process extends posteriorly or backwards and laterally. Here is an oblique picture of a vertebra. Here is the spinous process, and here is the transverse process. Here is the transverse process, backwards and laterally, here. The transverse process extends from the junction of each pedicle and lamina. Extends posterolaterally here, and from the same site where the pedicle meets the lamina, the articular processes extends. We have two superior articular processes and two inferior articular processes, one on each side. The superior articular processes articulate with the inferior articular processes of the vertebra above, and the inferior articular processes articulate with the superior articular processes of the vertebra below. Now look here, between the vertebral body and the origin of the articular processes superiorly and inferiorly, we have notches on each pedicle, and these notches on pedicles forms the superior and inferior margins of the intervertebral foramina. Now let's talk about the typical cervical vertebrae. Remember, what was the characteristic of cervical vertebrae in general? They share their small size and the presence of foramina transversarium. But the typical cervical vertebrae share the following characteristic. Let's talk about the body, then the transverse process, then the spinous process, and the vertebral foramen. Starting with the vertebral body. The vertebral body is short in height and have a superior concave surface and an inferior convex surface. It's square shaped, so short in height with superior concave surface convex inferior surface, and square in shape. Then we have the transverse process. It is a trough-shaped. Trough, like this container that animals use to drink or eat, and it is perforated by rounded foramina transversarium. Now let's take a look at this spinous process. It's short and bifid. Finally, the vertebral foramen is triangular in shape. So features of typical cervical vertebrae: short in height vertebral body, which is concave upwards, convex downwards, square shaped. Then the transverse process is trough shaped and perforated by a rounded foramina transversarium. The spinous process is bifid and short, and the vertebral foramen is triangular in shape. Here's an X-ray of the cervical vertebrae. As you can see, here is the spinous processes. Here is the first rib, here is errant trachea. Here is the tubercle of the first cervical vertebrae. Here is the vertebra prominence. Why it's called that way? It is the seventh cervical spinous process. It's called vertebral prominence because you can feel it. Here is the vertebral bodies, and this black line in between the vertebral bodies represents the intervertebral disc. Let's talk about the atlas and axis, C1 and C2 respectively, C1 being the atlas and C2 being the axis. They are specialized cervical vertebrae that function to accommodate movement of the head. Let's see this X-ray with an open mouth. Here is the atlas. Here is the lateral mass of the atlas. Here is the dens of the axis, and here is the axis. This line represents the inferior articular surface of atlas. This line represents the superior articular surface of axis. The superior articular surfaces of the atlas articulates with the occipital condyles just sides of the foramen magnum. The major distinguishing feature of cervical 1 is their lack of vertebral body. This is C1. This is the atlas. Can you see a vertebral body? I cannot. There is no vertebral body. This is the distinguishing feature of the cervical 1 vertebrae. Why so? Because in fact, when during embryological development, the vertebral bodies of first cervical and second cervical vertebrae fuse together to form the dens of the axis. And that's why there is no intervertebral disc between C1 and C2. Let's describe the atlas or cervical 1 vertebra. Not only it lacks a vertebral body, but also it is ring-shaped, composed of two lateral masses here and here, two lateral masses that are interconnected through short anterior arch and longer posterior arch. So ring-shaped vertebrae composed of two lateral masses that are interconnected through short anterior arch and longer posterior arch. Now each lateral mass articulates above with the occipital condyles of the skull and below with the axis, with the superior articular process of the axis. Let's describe the superior articular process of the atlas. They are bean-shaped and concave, whereas the inferior articular processes are flat and almost circular. Superior articular surfaces, bean-shaped and concave. Inferior articular surfaces, flat and almost circular. The atlato-occipital joint, the joint between the atlas and the occipital condyles, allows the head to nod up and down on the vertebral column. This is the atlas. It moves upward and downwards, allowing the head to nod upwards and downwards. Now look at the anterior arch. As you can see, here is on the inner surface of the anterior arch, you have an articular facet. This facet is for the dens. The dens projects superiorly from the vertebral body of the axis. Here is the vertebral body of the axis, dens extends upward from the superior body of the axis. How is dens held in position? By transverse ligament of atlas. Transverse ligament of atlas, posterior to it and spanning the distance between the medial surfaces of the lateral masses of atlas. Here is the lateral mass of atlas. Here is the medial surfaces. This transverse ligament spans the distance between the medial surfaces of the lateral masses of cervical 1 vertebrae. and just posterior to the dens. That's why it keeps the dens held in position. Now, what is the function of the dens? It acts as a pivot point. It allows cervical 1 vertebrae and the head to rotate on the axis from side to side. So it allows lateral rotation of the head on the atlantoaxial joint. Now let's describe the transverse process of the cervical 1. It is large and protrudes further laterally than those of other cervical vertebrae. So if I asked you which transverse process travel much laterally of cervical vertebrae, you should answer the transverse process of cervical 1. This transverse process acts as levers for muscle action, particularly which muscles? Muscles that move the head at the atlantoaxial joint, facilitate lateral rotation. Take a look at the axis. Here is the axis over the cervical 2 vertebrae. It is characterized by tooth-like dens, which extends superiorly from the vertebral body. Now, the anterior surface of the dens, as you can see here, has an oval facet for articulation with the anterior arch of the atlas here. And the two superlateral surfaces of the dens have circular impressions. These impressions serve as attachments for strong alar ligaments. These ligaments connect the circular impression of the superlateral surfaces of the dens to the medial surfaces of the occipital condyles. So alar ligaments, they connect the superlateral surfaces circular impression of the dens to the medial surfaces of the occipital condyles, one on each side. What is the alar ligament function? They check rotation of the head and atlas in relative to the axis. So they don't allow excessive rotation of cervical 1 and the head in relation to the axis. Let's take a look at the thoracic vertebrae. They are all characterized by articulated ribs, but typical thoracic vertebrae specifically are characterized by two costal facets, one superior, larger, for articulation with same rib, and one inferior, below, for articulation with the rib below, and the transverse costal facet for articulation with tubercle of the same rib. Then the vertebral body of the thoracic vertebrae is somewhat heart-shaped, and the vertebral foramen is circular in shape. This is an X-ray represent the thoracic vertebrae. This is the intervertebral disc. Here is the vertebral body. This is the transverse process. Here's the spinous processes in the middle, and here is the intervertebral disc. In lateral view, you can see this black line represents the intervertebral disc, and this white thing is the vertebral body, and in between vertebral bodies is intervertebral foramen. Now, time for lumbar vertebrae. The 5 lumbar vertebrae are characterized by their large size. However, typical lumbar vertebrae are characterized by first, lack of facets for articulation with the ribs, and the transverse processes are generally thin and long, with the exception of transverse process of lumbar 5 vertebrae. Why? It is massive and somewhat cone-shaped for the attachment of iliolumbar ligaments that connect the transverse process to the pelvic bone. Now let's describe the typical lumbar. First, we have to mention the lack of costal facets. Next, we have to describe the transverse process, which is long and thin. Then the vertebral body is somewhat cylindrical in shape, and the vertebral foramen is triangular in shape. This is an X-ray of the lumbar vertebrae. Here is the transverse process. Here is the pedicles, spinous processes in the middle, intervertebral foramen, intervertebral disc, and vertebral bodies. Let's talk about the sacrum, which is a single point, represents the 5 fused sacral vertebrae. It's triangular in shape and curved backwards. So it has a concave anterior surface and correspondingly a convex posterior surface. It articulates above with the 5th lumbar vertebrae and below with the coccyx. It also has 2 large shaped facets on each lateral side for articulation with pelvic bones. Now the posterior surface of the sacrum has 4 pairs of foramina, and the anterior surface of the sacrum has also 4 pairs of foramina. So we have anterior sacral foramina, and posterior sacral foramina. These foramina are responsible for the passage of posterior rami posteriorly and the anterior foramina for the passage of anterior rami of spinal nerves from sacral 1 to sacral 4, sacral 1, 2, 3, 4. Last note about the sacrum, that the posterior wall of the vertebral canal may be incomplete near the inferior end of the sacrum here. The coccyx, last vertebral bone. It's a small triangular bone that it articulates with the inferior end of the sacrum. It represents 3 to 4, usually 4 coccygeal, fused coccygeal vertebrae, characterized by its small size and the absence of vertebral arches, and therefore a vertebral canal. There is no vertebral arches, and so there is no vertebral canal in the coccyx. Now moving to the intervertebral foramina. It's formed on each side between adjacent parts of vertebrae and associated intervertebral disc. It allows structures such as spinal nerves and blood vessels to pass in and out the vertebral canal. It's formed by the inferior vertebral notch on the pedicle above and the superior vertebral notch on the pedicle of the vertebra below. What are the borders of the intervertebral foramen? Posteriorly, the zygapophyseal joint between articular processes of the two vertebrae. Anteriorly, the intervertebral disc and adjacent vertebra. So, each vertebral foramen is a confined space that's surrounded by bone and ligament and joints. So, any pathology in any of these structures or the surrounding muscles can affect structures within the foramen, such as bone loss, herniation of the disc, dislocation of the joint, or pathology in the muscles, all of these pathologies. Lastly, the posterior spaces between vertebral arches. Now, in most regions, as you can see, of the vertebral column, the laminae and spinous processes of adjacent vertebrae overlap to form reasonably complete bony dorsal wall. Here's complete bony dorsal wall for the vertebral canal. However, look at the lumbar area, look at the lumbar region. There are large gaps in between the posterior component of adjacent vertebral arches. These gaps between adjacent laminae and spinous processes become increasingly wide from lumbar 1 to lumbar 5. It can also be widened further by flexion of the vertebral column. These gaps allow relatively easy access to the vertebral canal for clinical procedures such as lumbar puncture. Now, time for questions. Please take your time and answer in the comment section down below. All of the following contribute to the bony framework of the back except vertebrae are subdivided into 5 groups based on cervical vertebrae are characterized by thoracic vertebrae are characterized by lumbar vertebrae are characterized by which of the following vertebrae support the posterior abdominal wall? Number 7. One of the following statements is true. Question 8. Transverse processes of which vertebrae are large and protruded further laterally than those of other cervical vertebrae? The function of vertebral projections is the lateral pillars of vertebral arch are Number 11. Transverse process is a bony projection that originates from spinous process is a bony projection that originates from which part of vertebra is the major weight-bearing component? The largest vertebral body is seen in which vertebra? The smallest vertebral body is seen in which vertebra? Superior and inferior articular processes of vertebrae originates from superior and inferior margins of intervertebral foramina is formed by the major distinguishing feature of axis vertebrae is One of the following descriptions of spinous processes of typical cervical vertebrae is most accurate. Vertebral foramen of typical cervical vertebrae is foramina transversalium is one or more of the following cervical vertebrae is not typical. Atypical cervical vertebrae are responsible specifically for the major distinguishing feature of atlas vertebra is one of the following statements best describes the atlas vertebra. Superior articular surfaces of atlas vertebra are alar ligaments connect the dens to wedge head movement occurs at the atlano-occipital joint. One of the following ligaments holds the dens in position. Wedge head movement occurs at the atlano-axial joint. Transverse ligament of atlas originates from one or more of these bones participate in forming the posterior pelvic wall. 34. Transverse processes of cervical 1 act as levers for muscle action that move the head at the what joint? 35. One of the following descriptions of typical cervical vertebral bodies is true. 36. Superlateral surfaces of dens serve as attachment sites for which ligament? One of the following check excessive rotation of the head and atlas. Inferior articular surfaces of atlas vertebrae are one of the following is not a feature of typical thoracic vertebrae. One of the following is not a feature of typical lumbar vertebrae. 41. All of the following are features of the sacrum except one of the following is not a feature of coccygeal vertebrae. 43. One of the following does not affect structures passing through intervertebral foramen. 44. The posterior border of intervertebral foramina is formed by last question. The widest posterior space between vertebral arches is. If you like this video, please subscribe and hit the like button to keep me encouraged and keep uploading for you. Thanks for watching.